Last week, the Biden administration declared monkeypox a public health emergency, which essentially triggers funding for resources to fight the virus. Just a day after the announcement, Illinois state officials reported that a person who works at a daycare center in the small town of Rantoul tested positive for monkeypox, potentially exposing kids. And with just weeks to go until the start of a new school year, parents are now facing the prospect of keeping their kids safe from monkeypox while still dealing with the threat of COVID-19. And joining me to discuss how the heck we're going to do this school year without a mask mandate in place is Dr. Ebony Hilton. She is the co-founder of the healthcare consulting firm Goodstock. She's also an MSNBC medical contributor. So Dr. Hilton, how much community spread of monkeypox is there actually out there? Obviously, the case number the total number is a lot lower than what we're used to seeing with COVID. So lay it out for us. How concerned do we have to be as an average person?
Right. I think it's a lot lower than we see with COVID now. But we have to remember back in March of 2020, right, when we didn't have this upscaling of testing available and persons were not being necessarily diagnosed with COVID who had it, right? And I think we're seeing the same thing here with monkeypox because the presentation of monkeypox can vary greatly, for one. But for two, we know that there's a lag time of at least weeks that you can have before you get infected to having symptoms. And unfortunately, even with this being the case, we've increased our caseload by about 82% in the last 2 weeks. This is a growing number that should concern everyone in America, and particularly because we don't have the vaccines to keep up with the demand that we have now.
So in terms of school openings, what are the mitigation tools available to us to help mitigate or lower the spread of monkeypox? Are they the same as COVID?
Right. Very similar. The same things we would do as far as contact tracing and surveillance testing. That's truly what we need to do, because, again, the surveillance testing is just to see where are the cases that have not yet presented with these lesions, right? We want to catch those persons who are in that early stage of infection, but also getting those vaccines into the arms of persons that are the highest risk, making the awareness of what these lesions look like and how to protect yourself and isolate, give persons resources that they can actually stay at home. That's going to require them to have money, unfortunately, that the government oftentimes wants to hold on to. But those persons are going to need money and funding in order to keep themselves in that isolation period. But then how do we get the treatment options to those persons that are the most vulnerable? And thinking about the children, we had the case of the daycare center with the infection, getting those parents the resources they need to protect their children, the little ones, but then also everyone they came into contact with within those last few weeks. And that could be a broad area to cover.
As we head into the school year, I keep thinking about the fact that we sort of enter the school year every year in the pandemic, and we don't do anything different. We don't do anything differently. We're like, no mask mandates. What's the worst that could happen? And we act like we don't know. But I feel like we sort of have to be a little bit smarter this school year. Do you worry about congregate settings like schools or even other places where large groups of people, workplaces, are gathering when it comes to now the COVID surge of BA.5, but also monkeypox?
For sure. I think monkeypox is going to show us just how unprepared we are, and in ways that COVID did not. The physical scars that are going to be visible for persons to see will allow us to see how this pandemic actually spreads amongst ourselves. With COVID, people were asymptomatic. They were walking around. You could not tell who had COVID or who didn't. In this time of monkeypox, I think that physical, scarring that's left behind will cause us to hopefully ramp up our efforts to mitigate the spread in ways that COVID did not. But I have to urge the people, we hear this thing and we think it's only a physical scar, and that's the only thing that people are really focusing on. But monkeypox scars also on the inside, too. We know that it can cause other debilitating conditions. And when we're thinking about our children in particular and the rolling back of these precautions, we have to understand kids are considered high risk. We know that many children now are missing out on the standard vaccinations, not even, talking about the smallpox vaccination. But we know those children, but also thinking about the college-age kids. When we were in college, we thought we were invincible, and we are going about life not understanding that we are the vectors that are spreading this virus throughout the community. And how do we get our our voice into the ears of those college students to say that you can be a part of this campaign to mitigate this spread, and these are ways that you can do it. I think we need to champion them to be advocates in stopping the pandemic on both fronts.
How are you feeling about the fall and winter in terms of COVID, just COVID? Because we don't yet have adequate funding for additional vaccines that are going to be necessary. They haven't opened up availability for the vaccine second booster shot to people under the age of 50 officially. What concerns do you have top of mind heading into the fall and winter?
This fall definitely scares me. If you look at the history of COVID, we know we've had surges every July. We had the original surge in July 2020. July 2021, we had Delta. In July 2022, we've now had this surge of Omicron BA4 and 5. What we also, though, see is a larger surge that happens in November, right? Where we have the colder winter bringing in persons into the house. People are gathering inside. And unfortunately, at this point, we've had a stalemate, a plateau of vaccination that has not budged in the last few months. People are not getting boosters. And so we're going to have this waning vaccine efficacy in the meeting of the surge of the virus, and it could make for a very troubling winter.
I would highly recommend everybody re-up on their masks. That's what I'm hearing from Dr. Hilton. Dr. Ebony Hilton, thank you so much for being here today. Please stay safe.
Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.